Existing research and our networks across low and middle-income countries indicate that the poor availability, affordability, and accessibility of medication is extremely challenging for people with Parkinson's, as is the limited information on the condition and its management due to low numbers of medical and allied health professionals. This makes it difficult for people living with Parkinson's disease and their families across much of the world to effectively manage Parkinson's. Today, we're going to talk about a pilot case study we are implementing, which will aim to replicate an existing model of community care from the Indian context to the Kenyan context, led by Dr. Maria Barreto, Dr. Tash Fothergill-Misbah, and Helen Muthiga.
I am Dr. Maria Barreto, CEO of the Parkinson's Disease and Movement Disorder Society, a non-profit organization in India founded by renowned neurologist Dr. B.S. Singhal. The focus of our work is to understand the needs of people with Parkinson's in our country, identify available resources, and design programs given the opportunities and the challenges of our context. It also involves raising awareness and information amongst all stakeholders, including people with Parkinson's, their families, medical and allied health professionals, not-for-profit organizations, and relevant government agencies.
I am Dr. Tash Fothergill-Misbah. I'm currently a postdoctoral researcher based in Newcastle upon Tyne in the UK. My research is focused on the lived experiences of Parkinson's disease in sub-Saharan Africa, particularly in Kenya. While carrying out my research, I worked with an existing Parkinson's support group in Nairobi, which was established in 2012, and I established a second group in Mombasa in 2018. The groups aim to give people with Parkinson's disease and their families a space to learn and share through monthly meetings, and more recently through bi-weekly virtual meetings during the pandemic. However, this support is not evidence-based and is run on a voluntary basis, which is where it differs from the work that Maria does in India.
Hi, I'm Helen Muthiga and I'm the founder of Africa Parkinson's Disease Foundation in Nairobi. With no medical background, I felt the need to start a foundation to support people living with PD in Kenya after the death of my father in 2010. He had lived with Parkinson's disease for 16 years. As a family, we struggled with lack of information on the disease, the high cost and low supply of PD medication, and high level of stigma due to the association of the disease with witchcraft in our country. Challenges around Parkinson's in Kenya include limited information about the disease, low access to healthcare, high costs of neurological care due to low number of experts, high cost of medication, and lack of government support. When Maria and I met in 2016 at the WPC in Portland, we shared the common challenges facing our two countries, and the need to explore collaboration emerged. This was furthered when Maria and Tash met in 2019 at the WPC in Kyoto at the Leadership Forum. We then remained in touch through the working groups that were developed post-conference.
The PDMDS initiated its first community support group in 2005, based on an analysis of the needs of people with Parkinson's and the availability of resources. This support group was conducted at a community hall by volunteer allied health professionals and a small but enthusiastic group of people with Parkinson's. The overwhelming response, both in terms of the increase in the number of members and the level of engagement, reinforced our belief that a community-based support group program was a move in the right direction. We then strategically defined our objectives, which were to increase Parkinson's awareness in India, to provide community-based multidisciplinary rehabilitation through urban, rural, and tribal support centers across the country, to identify, train, and develop human resources to run these centers, to develop evidence-based programs, and to provide education about neurological conditions in the elderly and promote healthy living. The first step to achieve these objectives was the development of the multidisciplinary model that could be delivered through a community-based program. The model was designed, validated, and documented in 3 phases. Phase 1 involved design of the content. Phase 2 was an evaluation of its efficacy, and Phase 3, documentation. The model includes education and multidisciplinary intervention. The next step was to replicate the model in varied settings. This involved adaptation, sensitization of the community, training of personnel, and identifying collaborators and financial sponsors. This model is being delivered through a network of 62 urban, rural, and tribal centers across our country.
Africa Parkinson's Disease Foundation is the first and only organization in Kenya that is dedicated to improving the lives of persons living with Parkinson's disease, their caregivers, and families. The organization was established in 2012 and registered as a non-governmental organization in Kenya in January of 2013. The objectives of the organization include to promote public awareness and contribute to the development and sharing of greater knowledge and information on Parkinson's disease, to establish guidelines for a continuous education program for patients of this disease and to make it available in writing and online, to improve the quality of life of Parkinson's disease patients all over Africa, to support research on Parkinson's disease through eventual promotional campaigns, to establish and maintain contacts with national and international organizations with the aim of promoting laws, regulations, and measures in favor of patients suffering from Parkinson's disease.
From my research in Kenya, we know that people want to learn about their condition. They want to share their experience, learn from others, experience camaraderie, find ways to deal with the vast symptoms that Parkinson's comes with, and ultimately, they need support. However, they are receiving none of this from healthcare services. Although 2 support groups exist in Kenya, they only offer support to a limited number of people, largely from urban areas, and their reach is restricted. The groups do not have the capacity or funding to widen their reach or employ people to deliver the services. The low number of experts in the field of neurology, occupational therapy, physiotherapy, speech and language therapy, and nutrition, all aspects of care that people with Parkinson's can use to manage their condition, also limits the type of knowledge that can be shared with group members.